at the UA College of Medicine in Phoenix and the Pre-Medical Admissions Pathway Program at the UA College of Medicine in Tucson recruits students that represent the diversity found within Arizona and the nation, while helping carve out a path to medical school that some students may have thought impossible.
Since I was homeschooled and my parents are not supportive of higher education, for me it was understanding that this was even a possibility. So my first goal was to get a bachelor's degree, and that becoming a doctor seemed so far-fetched for me that it took a long time for me to understand that it could be a reality.
I think the biggest challenge was moving to the US. That was a culture shock for me. It was kind of difficult because I didn't know how to speak English at all. So I had to learn that, and that took a little bit away from my confidence. And you know, this is a big dream. Maybe I shouldn't pursue it. Maybe I should just be more conservative. But I think just finding that confidence in me and believing I could do it, that has been the biggest challenge.
I was born in Somalia, but we fled from the civil war in Somalia to Kenyan refugee camp, Dadaab, which is known today as the world's largest refugee camp. So I lived in the refugee camp for 17 years before coming to Tucson.
I'm Navajo, and my family is originally from thesis, Arizona, which is located on the Navajo reservation here in Arizona. But I grew up in a border town right next to it in Kirtland, New Mexico.
Part of the PhD program, you have to do a master's thesis. For my thesis, I chose to do a literature review on a malaria antigen.
We're doing a study on a woman that has breast cancer, and I'm measuring how they cope with this diagnosis with their husbands. So I want to measure the difference on how Hispanic women cope with cancer as in a relationship compared to non-Hispanic white women.
Cultural differences do play a part in healthcare. I think when you have a patient come in, and I experienced it with my own father. He had cancer, and as my dad got worse with his cancer, you know, it was hard to explain, you know, medically what was going on, and also with the traditional treatments we were doing and then the Western medicine, it didn't quite line up very well. So, you know, seeing that with my dad, it pushed me to work with, you know, things like cancer. Cancer is an unspoken topic in our community, and a lot of Navajo families don't talk about it. So my research goes into pancreatic cancers.
My research project is looking at a protein that's expressed in the brain that levels are increased in instances of chronic stress and anxiety, which leads to depression.
Mentoring is a big part of PMAB. We not only have our cohort, but we have mentoring physicians like Dr. Gonzalez, mentoring us on, you know, clinical skills and any questions we had about, you know, what it's like to be a physician. And on top of that, we were also partnered with different residents. The resident I was paired with was also Navajo, which is, you know, very rare. My
drive to become a physician started while I was still in the refugee camp. The only healthcare providers are the Doctors Without Borders. And those Doctors Without Borders are from all over the world. Some are from the US. So they have left, those Doctors Without Borders have left, you know, their luxury lives, their well-paying job here, to go volunteer in people that live, you know, offshores, people that share not their culture, not their language, not even their religion. And then I saw them, you know, working in the camp. Then I looked at them as my heroes. Watching those, you know, physicians, I said to myself as a refugee kid that I should be able to follow these footsteps. That's the only way that I can honor their commitment and the service they provide to refugee camps.
Graduates of the Pathway Scholars and Pre-Medical Admissions Pathway programs are accepted into the UA College of Medicine in Tucson or Phoenix.